well-being is so clear to see, and it makes the call for high-level commitment even more urgent.
Definitely, De Graft. I'm anticipating big things to come out of that session. And the sexual reproductive health and rights session really highlighted how youth and adolescents' choices vary depending on where you live in the world. So, time's up for your next core sessions, and they are building the agency of adolescents through quality programming and accountability. It's International Day of the Girl Child today, and this is your chance to join other young people, including girls from marginalized communities, in a conversation about gender justice, education, well-being, and it should be an incredibly fascinating conversation. Or you could find out what's happening in the USA. If you choose this one, Taking Action for Adolescents, and this is all about the United States National Adolescent Health Action Plan. So join our colleagues there to hear more about this initiative and how it provides support for youth accessing health services.
Sounds super interesting. And hold on to your hats meanwhile for something quite inspiring and moving. You are about to see the winners of the Art for Wellbeing competition in the design category. So enjoy. We'll be back after the core sessions as usual. Drum roll.
My name is Arsana Karki. I am an artist and a law student. I am 22 years old and I am from Nepal. Thank you so much for this wonderful opportunity. For me, it is a significant milestone in my art journey. It is wonderful and fulfilling experience to share my platform with different diamonds artists and having a different diamonds thought process. I'm really honored for that. So taking part in this competition is one of the best things that I have ever done, because I had chance to not just share my platform, but I have chance to express myself, what actually it feels to be alone, what it feels to be heard, what everyone needs someone to listen your overall situation no matter what. So this competition had taught me you don't need to be more, or you don't need to be big in your age, but you can make a positive impact in your life. One thing that everyone should realize, that pain is not what you see, pain is what you actually feel. So I had a professional as well as thought process development, so I'm really motivated to explore and create such art which really has a positive impact in my society and my life. Thank you so much.
El bienestar es estar bien con tu mente, es estar en un viernes con tu gente, como superstar en un rap contundente. Se trata de superarse y vivir el presente. En el rap demuestro autonomía y resiliencia. Si me quiero expresar, nadie me silencia. Tengo silenciador con una recarga de conciencia. Si te identificas con esto, no es una coincidencia. La base de mi autonomía es mi autoidentidad. Mi origen son las letras, un autóctono verbal. Autonomía es tomar la decisión de rapear y digan lo que digan, en consecuencia actuar. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar. Ya, contribuir a la sociedad se vuelve algo vital. Eres único y recuerda, tienes algo que aportar. Como músico de letras lo debes comunicar. Encuentra valor en ti mismo ayudando a los demás. No temas expresar lo que hay en tu corazón. Escúchate este tema y conecta con tu pasión. Estoy contratando letras a medio tiempo para hacer empleabilidad en una canción. No pierdas el rumbo, invierte en tu educación. Nunca veas al estudio como una obligación, sino como una oportunidad de reflejarse en el bello mundo del aprendizaje. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar. Ya, libre de practicar mis creencias, intimidad con mi rap y las letras, sin discriminar, libertad de conciencia y desarrollarse como consecuencia. Son secuencias de sonido diario, solo buenos hábitos alimentarios. Yo me alimento de rap y diccionarios, mi cabeza llena de enciclopedias y glosarios. Salud depende de una buena nutrición, futuro depende de una buena educación. Desarrollo es vivir sin discriminación, bienestar es escuchar la rap generación. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar.
Rien n'est plus bon, satisfaisant qu'un simple bel sourire, juste parce qu'on est heureux. Tout ça pour soi, pour son bien-être, afin de rester ensemble, de son propre bonheur. Je n'ai pas s'inquiéter, je serai ce que tu es. Je suis fier de ce que je suis, oh no way. Nous savons être comme nous sommes tous humains. Soyons fiers de ce que la vie à nous offrir. Non, on est tous différents, les sens sont si différents. J'accepte ce que je suis, accepte ce que je suis. Peu importe mon physique et mon état de santé, mon bien-être au mien et tout ce que j'aurais voulu avoir. Je suis fier de ce que je suis. Sois fier de ce que je suis. Accepte ce que je suis. Fais ça pour mon bien-être. Je serai fier et satisfait de ce que j'aime, même confie. Me réveiller chaque matin, entouré des gens qui m'aiment bien, qui comprennent bien ce que je suis, qui comprennent bien ce que je ressens, qui m'acceptent que je suis. On est tous différents, des sensations différentes. J'accepte ce que je suis, accepte ce que je suis. Peu importe mon physique, ni mon état de santé, mon bien-être au mien, et tout ce que j'aurais
Good morning, afternoon, or evening, depending on where you are in the world. I'm thrilled to welcome you to Take Action for Adolescents, a call to action for adolescent health and well-being. We'll begin in a moment, but first, just a few logistical items. First, please introduce yourself in the chat with your name, what country you're from, and what organization or school you're affiliated with. And you'll find that first icon on the top right corner is the chat. And then please post questions in the second icon on the top right, the Q&A section. And most importantly, for access to interpretation, use the audio interpretation button at the bottom right of the video with the alphabets. My name is Jessica Swafford Marcella, and I'm the Deputy Assistant Secretary for Population Affairs and the Director of the Office of Adolescent Health at the U.S. Department of Health and Human Services, also known as HHS. The Office of Population Affairs advises HHS leadership on a wide range of reproductive and adolescent health topics, including teen pregnancy prevention and family planning. I'm so pleased to be here today to provide a preview of Take Action for Adolescents, a call to action for adolescent health and well-being. I'll review how the plan was developed, who was involved in creating it, our vision and goals for the plan, and how the plan is organized to spur action. So listen, as a public health official, former health advocate, and a parent of 2 children who will soon be adolescents, I know how critically important it is to make sure that young people are thriving now, when they become adults, and into the future, when many of them may be parents or guardians of the next generation. This is what the Lancet Commission called the triple dividend that will come from investing in adolescent health. With this triple dividend in mind, my staff has been working diligently with a wide array of youth and adult experts to craft an action plan to promote, improve, and sustain investments in adolescent health and well-being. When we talk about adolescent health and well-being, we're thinking about more than access to and utilization of healthcare services. This new action plan or call to action articulates a vision that all adolescents in the United States have the safety, support, and resources to thrive, be healthy, and have equitable opportunity to realize their full potential. The breadth and scope of this vision requires intentional collaboration and coordination across all levels of society, including government and non-government agencies, working in concert with young people themselves, parents and legal representatives of young people, educators, clinicians, researchers, academics, advocates, and other youth-serving professionals. The vision is very ambitious, but it's one I think we can and should work together to achieve. So no, we have built this plan on a foundation of research and a set of key cross-cutting principles. They are full and timely access to health and social services, focusing on agency so that young people can make or influence decisions about their lives and set their own goals. Health equity is at the center of everything we do. Meaningful youth engagement is paramount. Positive youth development, defined as building on young people's strengths and potential rather than seeing them as a collection of problems to be solved. Quality in healthcare and social services. And perhaps most importantly, taking a whole person approach that addresses all aspects of a young person's life rather than individual behaviors or symptoms. So I want to take just a moment to talk about what we did, because OPA undertook a deliberate, iterative process to obtain the most important, timely, and useful information on adolescent health and well-being to serve really as the foundation for this call to action. We conducted a scan of the current literature on adolescent health and well-being, an environmental scan of adolescent health and well-being programs and initiatives in the federal and non-federal sector. These data sources for the environmental scan included prior work completed by OPA, including adolescent health campaigns and partner webinars, reviewing bibliographies and existing literature, hosting a series of listening sessions, and then really calling through seminal reports and strategic plans on child and adolescent health and well-being. We then conducted a qualitative research study consisting of interviews and focus groups that delivered findings on the current state and future vision of adolescent health. And the findings were based on the insights and perspectives of youth-serving professionals, academics, researchers, clinicians, advocates, parents, and a diverse group of young people from around the U.S. In conducting this work, we centered the diverse experiences and knowledge of adults who work with young people and adolescents themselves. I think it's really notable to say that our qualitative research involved 102 participants from multiple sectors, representing 9 stakeholder groups with data from 16 focus groups and 18. All is to say, we had a number of conversations. And I'm really proud to say that young people made up 24% of the study sample. Because as we said at the outset, it is so critical to get the experience and expertise of young people themselves as we're thinking about adolescent health and well-being. And I'll say the adult participants shared their expertise in mental health, sexual and reproductive health, serving historically underserved groups such as LGBTQI plus youth and youth with disabilities and more. And many of the leading experts in adolescent health and development in the U.S. participated. And so we are grateful for everyone's contributions. When I distill this down to what we learned, I think the study findings highlighted just a couple things which I want to touch on. First, addressing unmet basic needs, the harmful policies and pervasive systemic challenges to support all young people, advance health equity, and address those challenges to help adolescents thrive now into adulthood. There was a real emphasis on providing more mental health resources and services to youth, as poor mental health can lead to negative outcomes and impact young people's ability to thrive. There was consistent findings around standardized and destigmatized sexual health education and information that is accessible to all young people. We saw that there was true need for supportive, trusting, and culturally competent adults who have the young people they serve and will listen to them and understand them. And perhaps, unsurprisingly, there was really a focus on education and training and additional resources to help adults work with young people to be more effective in their work. I should say this action plan includes the vision statement I shared earlier, key principles, goals, opportunities and challenge, and a set of specific actions. So it is a very meaty document that we hope that people will use in communities themselves. And the plan recognizes that young people's healthy development is interconnected with their environments, including their schools, families, and communities, and that caring adults from many sectors can play a role in helping them successfully transition to adulthood. So really, it's designed to sort of motivate, energize, and inspire anyone who has a role supporting young people to customize and implement the action steps. Ideally, the plan will serve as a template for caring adults to create their own action plans that address the needs of adolescents they serve or youth serving adolescents they train and support. I just want to say one more time, I noted at the outset that the development of this plan was iterative, and here's what I mean. While drafting and revising the plan, we held multiple engagement sessions with allies and partners to obtain their valuable perspective and input. We obtained this feedback in virtual interactive sessions with government agency partners, with young people, and with staff from national youth serving organizations, and even state policy agencies. I have talked about how we engaged researchers, academics, clinicians, and advocates, all of whom actually reviewed and added to the action plan's draft action steps. The graphic here depicts some of the many U.S. government agencies that provided feedback, and I also want to note that we held a virtual youth town hall in May of this year to get input from a diverse group of young people from across the country to make sure that it resonated. We worked collaboratively with our government colleagues, state and local youth serving organizations and programs, other health and social service providers, parents and youth experts. And that's really how we developed the set of 8 goals and action steps to align with each goal. And the goals, opportunities, and challenges and actions are built on the foundation of the vision and key principles. So I feel like before we turn it over to our session, I want to do a couple more things, which is 1, highlight the goals themselves, because this truly is designed to empower all adolescents to be well and thrive. And so each goal is actually described in a short introductory paragraph and has a line set of opportunities and challenges and an initial set of actions really intended to advance the goal and improve what we're hoping to seek. So as you can see sort of here laid out on the slide, we have a goal around eliminating disparities to advance health equity, increasing youth agency and youth engagement, ensuring access to safe and supportive environments, expanding access to healthcare and social services, increasing system coordination and collaboration within and across systems, strengthening training and support for caring adults, improving health information and health literacy, and finally supporting and translating and disseminating research. The action plan and its action steps are not prescriptive or exhaustive. They are meant to be a starting point for further brainstorming, for cooperation and collaboration across disciplines and sectors. And they're meant to be for use at different levels of government and community that affect young people. Really, it's meant to inspire everyone who cares about young people to take action to ensure that they have a healthy future. So that completes the overview of the action plan. But now, before we transition to our panel discussion, I'd like to share some of the work that OPA has been doing to walk the walk on meaningful youth engagement. For the last 3 years, we have asked young people ages 13 to 21 that participate in our grant programs to share their thoughts and experiences with us about the pandemic, their health, and what it's like to be an adolescent today. They submitted poetry, fine and digital art, videos, and original songs, and these submissions are presented in their original form to retain the young people's authentic voice. So you can see the 2023 submissions on our website and a compilation video on the OPA YouTube channel. But now I'd like to share a brief compilation video with you all. Thank you.
Youth Create is an annual celebration of youth expression, featuring work from youth participants in the Office of Population Affairs, or OPA's National Teen Pregnancy Prevention and Title X Family Planning grant programs. In 2023, OPA received more than 40 submissions from across the United States. They shared their thoughts on health in their communities, what is important to them, and their vision of a healthy future. Here's some of what they had to say. Young people candidly shared the health challenges they face and observe within their communities.
In my pictures, there are fruits and vegetables that are bright and full of abundance, the contrast to the stores that are in lower income.
Is this okay? Do you want to do this? Do you want me to stop? Can I?
I spent my life shielding my scars from prying eyes. I spent my life putting on a new mask each day to create the perfect facade.
I don't have no escape in this world. I have no peace.
I wanted to address mental health in the community in a way that highlights its hardships while also portraying the subjects in a more human way.
Young people cope with these challenges in a variety of ways, some of them personal.
During tough times, I pray and meditate and try to get myself through the situation, and I think adults can help by just being there mentally.
When I am going through a tough time, I always go to my art. I find peace in drawing and painting and being creative.
Taking chances.
I began to play the violin once again and started to be a part of the community. My connection with music has given me so much inspiration to help others and my communities to recover from the pandemic these past few years.
Youth also rely on their communities to support their health.
I have come to value having and being involved in a community more, building bonds that last through thick and thin.
One thing in my community that's very important to me is having programs like this that help out teens learn new things and build bonds with each other.
I have come to recognize that I am not living this life alone.
In addition to their observations of today, young people also have big visions for their future and their health.
We are each born with a brilliance that becomes our life's purpose to discover.
A healthy future means we live in a society that values the youth because they are who controls what happens in the years to come.
Finding a balance between all of the things you enjoy in life and finding peace with both sides of the elements to your life.
I've been told that beauty is in the eye of the beholder, and I've spent years looking for that beholder. And in the blink of an eye, I now know who it is. Me.
And as our flowers grow and grow to overcome adversity, bringing it back to the allotment, our little puddle will also become an ocean of opportunities. A healthy world to me and others is a place where our home is safe and never harmed.
Thank you again to all the young people who submitted this year. Check out the rest of their work on the OPA website.
Wonderful. And now it is my distinct pleasure to facilitate our panel discussion. We are welcomed by Micah Palacios, by Kimberly Waller, Dr. Carol Ford, and Dr. Paratosh Kaul. And so this is really the meat of the conversation. And I'm going to start with you first, Micah. So apologies for putting you on the spot. And then I welcome other panelists to join in. But which key health and well-being issues face young people in the U.S. today? You are a young person. Tell us your perspective.
Yeah, so when I think about this question, I instantly think of mental health, specifically kind of depression and anxiety young people are facing today. We really saw it in the pandemic, youth being isolated at home from their friends and their family. But then I think also looking at social determinants of health, maybe youth not having a safe environment, lacking the support system they have. And I think that's really important when making and providing resources for youth.
That's fantastic. How about you, Dr. Kaul or Dr. Ford? You all have been adolescent medicine folks for years and years. You're working with young people day in and day out. What do you see and what do you believe?
Well, this is Dr. Ford. I'll speak up. I agree. Emotional health, the clear priorities for all the reasons we've just heard. And I think it's not only depression, anxiety, things that we worry about, but also helping young people with emotional intelligence and problem solving and skills building, and essentially creating spaces for them to develop self-confidence and the courage they need to face the years ahead. I think we also need to remember physical health and sexual and reproductive health. So the focus on emotional health doesn't mean that we pay less attention to the other domains, but I agree that emotional health right now appears to be the priority in our country.
Hey, thanks. This is Paritosh Kaul. Thank you for inviting us. I would agree with what Marcella said and Dr. Ford said. What I would add is this whole person care. That is something which is important. Because it encompasses both the emotional and the physical and sexual reproductive health. The second thing which I think is a focus on on positive youth development, on positivity, those kind of strength based, what we call a strength based literature, uh, using that. I think so. Those are really important things, and I know that in the report we mentioned that teenagers, adolescents are often seen as problems, and not as as something that they are a great source of resources for us, as the program just showed us. So I think so that positive youth development, physical and emotional health, but also their sexual and reproductive health, all within the concept of whole person care and creating safe environments for them.
And Kimberly, over to you. Obviously, the Family and Youth Services Bureau does a lot of work with young people, and you yourself have even a lot of experience and expertise with particular populations like runaway and homeless youth. So, what would you offer to this conversation?
Yeah, thank you so much, Jessica. Wonderful answers. Completely agree with all the things that have been stated already. The addition that I would bring to the table here is how exciting it is that the conversation is focused specifically on youth and young adults. So often, our both mental and physical healthcare systems have been developed with a very kind of adult centric focus that may or may not be the best tools, services, and care for youth and young adults. So it's really exciting to see this conversation really focus on young people and what young people are saying that they need and that would help them thrive.
And just a follow up question, first to Kimberly, and then to everyone else. Like, when you look at the 8 action plan goals, which do you find most important, and why?
Yeah. I think this is a hard question for me to answer because they are all so important and valuable to the conversation. They're also very intersectional. So you can't really succeed if you don't focus on both engaging young people and understanding what young people need, and also focusing on eliminating health disparities, and focusing on ending systemic barriers and systemic inequities across our systems. And of course, you need coordination and collaboration across all of our systems. Unfortunately, government agencies and systems oftentimes function in silos, and that's just not how anybody lives. It's not how young people live. And so really focusing on eliminating those silos. And the one other thing that I would also bring up, I know I'm not answering just one specific goal, but it's really great to see that coordination with adults who are providing the services, and really creating a space where adults are also supported and trained and understand that this is a learning journey, that it never stops, and that it's really important that we continue to evolve our systems and our responses to meet the needs of all young people. Jessica mentioned that my office works with youth experiencing homelessness, and there are a lot of specific populations and special populations that really need to have a voice at the table, and really need specialized services. So just excited about all of these goals. It's hard to answer that question, so I kind of went for a few.
I appreciate it. Okay, now I'm turning to you, Dr. Call. You're being put on the spot. Which of the goals is most important and why?
I think, Jessica, I know you're a very fair person, but this is a really not so fair question. And I've struggled with this question for the past, since I've seen the action plan. I'm going to say if there's one thing we could do to really make a difference for the bang for the buck, it would be the first one, elimination of healthcare disparities. Because when we talk about health disparities, we are talking of every way and touching youth lives, touching agencies, touching healthcare providers, touching health researchers, the whole kind of everything. It's at that core. I think so. It's health disparities. So I'm actually going to say health disparities. If there's one thing we could all do together, it would be to eliminate health disparities, and we would it would result in a ripple effect.
Dr. Ford, your turn.
Yeah, it's tough because all of them are really important and there is a lot of intersectionality. I think that really, as a doctor and a parent and an editor-in-chief of the Journal of Adolescent Health, which is the professional journal, science-based journal produced by SAM, Society for Adolescent Health and Medicine. I'm going to have to go with the goal focused on research and evidence and supporting evaluation and dissemination of research and evidence and best practices, because it's important that when we invest, we use what's the best available information we have to make sure that our investments have the outcomes that we want them to have, that the young people actually benefit. And as I've gone through my career in my life as a parent and as a journal editor, I just realized that having the best available information available to inform your decisions makes a lot of difference in terms of whether your efforts and your investments actually have the outcomes that you want. So I feel this age group really deserves to have evidence and research informed strategies implemented, and avoiding kind of feel-good interventions that we don't know if they have any impact at all, which means that we also need more research because we don't have enough. But we have a lot more than we did several decades ago. We've made major advances in understanding how to best use our efforts. So I would have to go with that as a core goal, but it clearly supports all the other goals.
And finally, to you, Micah, which one rises to the top? And then I want to ask you a follow-up question, which is around how you think young people can play a role in sort of co-designing and implementing, the policies and the programs and the research affects them.
Yeah. So I think looking at the goals as everyone else, it was super hard, but goal number 3 stood out the most. The goal is ensure access to safe and supportive environments. I grew up in the 4-H Youth Development Program, and that supported a big foundation of well-being for myself and for others as well. I think young people need physical and emotional safety to develop and thrive for the future, and these environments promote mental health, and they reduce stress and encourage healthy development and in the long run. And I think for the follow-up question, can you repeat it again? Because I had my thought in the very beginning.
Yeah, of course. No, absolutely.
I lost track because I got so excited.
Absolutely. So the question was, what roles can young people play in co-designing or implementing policies and programs and research that affects them? And the reason why I asked the question, right, is we have these huge overarching important goals that are very broad in nature, very complex, and yet we want to center young people in all of the work that we do. And so just sort of from your experience, the ways in which you think that we could engage young people, or that other folks should be engaging young people, and how to co-design and implement, I think is really valuable in terms of recommendations and insights.
Yeah, I think town halls with youth are a great starting point because you get their perspective, and I think overall youth and adult partnerships work so well in creating collaborations, because as youth, we get to say our ideas and be in the process of it, but then the adults are there to guide, and you just create overall mentorship with each other, and you just create something so much bigger than I think just with one. It could just be one person, but with multiple people, it can just grow so much. And I think this action plan really shows that.
Kimberly, you're an administrator. You probably have some experience here about co-designing with young people. What are your words of wisdom?
Yeah, Micah, that's a really great answer. I would add really the importance of co-designing from the very beginning with youth and young adults at the table, and really positioning youth and young adults and empowering youth and young adults with the knowledge needed to be able to be key advocates at the table. And I think, from the very beginning, incorporating young people's ideas, young people's expertise, and thoughts and guidance along the way. And as you continue to design and implement whatever that might be, if it's a program that you're designing, a curriculum that you're designing, perhaps changing a policy, having young people be part of those conversations from the very beginning throughout the planning stage and into implementation. And then importantly, making a plan for continued quality improvement that includes youth voice in that part of the process. Even, launching something and beginning implementation is really important, but continuing to evolve and change as needed in response to what young people are saying, and their thoughts and ideas is equally as important. So really taking young people's voices and expertise from beginning to end and empowering young people with the knowledge that they need to really be key advocates and leaders alongside adults.
Fantastic. Dr. Ford, I want to start the next question with you because you highlighted the many hats that you wear. You said you're a parent. Obviously, you've been editor-in-chief. You are a physician by training. How can we ensure collaboration to promote adolescent health and well-being? How do we start to break down, the many layers of silos that exist?
Yeah, it's a great question. I think finding common ground is really an important strategy. And you can usually find nice common ground, particularly when you think about involving young people's voices and their parents and adult caregivers, and have kind of a micro as well as a macro strategy. So the idea when you really hear from young people and people who take care of young people, no matter what the setting, and parents and caregivers, and you usually can find common ground, even in politically volatile areas, and that can be really a wonderful place to build from. And so I think it's important to know the political environment and the complexities, but it's really important to also have young people speak and people who care for them about what they're facing in the real world. And I think that you can usually find common ground around most areas that you can start from. I think then also this idea of having allies and partners that are very diverse and from a broad spectrum of society is also really important, because you can definitely make a lot more progress when you have built your really coalition of partners and allies with common ground, and you stand together and you really advocate for what the young people need.
So true. Dr. Call, I'm coming to you. How can we ensure collaboration? What have you learned in your experience?
So I kind of echo what Dr. Ford is mentioning. I think so. For me, the three key principles would be: first is to learn. See, we can actually work together to ensure collaboration, is because when we are open to learning, we're open to listening, and coming from that spirit of being really inclusive. Can we hear every voice? Do we want to hear every voice? I mean, they seem to be philosophical questions. At the same time, this is core to really ensuring collaboration so that we are not working in silos. And I think so. This forum and the report that you have created, that has been created by your office, Jessica, is an example of how we've collaborated. You have invited youth voices, you've had listening sessions, and I think so. It might not seem the perfect, but I think so. This is an excellent building or a roadmap of how we could collaborate together across agencies, across people that care for adolescents and young adults, and that common, the north star being the health and well-being of adolescents and young adults. I'm unsure if I've answered your question, but that's how I think we could proceed and work together.
Absolutely. No, that was fantastic. Um, so just, refining a little bit now, since both Kimberly and I are actually administrators, I turn back to you, Kimberly, to ask the hard question about How can policymakers, and I'll expand it a little bit, and youth serving professionals best support adolescents?
Yeah, absolutely. I think the biggest key area here is, and this is kind of building on the prior question, is what are your goals and how are you building your coalition to move that forward? And importantly, who is at the table and who is missing from the table? Do you have culturally specific organizations at the table, bringing in diverse and equitable focuses? Do you have youth and young adults from diverse backgrounds who are at the table, and leading the charge there, and really identifying what's your core mission and what are your goals that you want to accomplish and achieve over the next year? Tools like this plan are really, really helpful to policymakers, to administrators, and to community organizations, so that we are all working together in lockstep towards similar goals and doing it in similar ways, with youth engagement, with a focus on diversity, equity, inclusion, and accessibility. And so really being laser focused on what it is that we want to achieve together and how are we doing that, and do we have the right people at the table to get it accomplished?
Micah, I'd like to ask from your perspective the same question. From where you sit, and you are such a strong and tremendous advocate for young people, how can policymakers and youth serving professionals best support adolescents?
Yeah, I think having youth on boards, like in your organization, youth councils, to help make these decisions and get perspectives. I think the previous panelists said it head on. Make sure the diversity of youth and having different people from all across the world, or to have bring those different perspectives, because then you can get a better shape for maybe a policy or direct for program that you want to create, and you can just see different get different perspectives. Because I think when you can have sometimes really tunnel vision, and maybe, okay, this is what they want to hear, but when you bring several youth together, and adults, they can just create something so much bigger. And maybe because I think it's always ever changing, so you don't want to just stick with one, always looking at multiple directions.
That's really great. You know, what Dr. Ford said struck something for me, and it's really around allies and partners. So I open it up to anyone in the conversation who'd like to react. But what do you think is the best way for our allies and partners to engage with and disseminate this call to action and the Take Action Toolkit?
I can jump in first. I think raising awareness is a really important first step. So it's upon all of us to ensure that the information is shared. It's shared broadly. It's shared with a diverse set of community partners, and that the conversation starts or continues depending on where each community and country is on their conversations in this space. So really, I think raising awareness, sharing information, and beginning or continuing the conversation is a bit of the step one. And I'll kick it over to other panelists to add.
I would say it's really important to talk about past successes and things that have worked, so that people understand that even though this work may seem overwhelming and impossible, it's not. We've had good successes with efforts that have made big improvements in adolescent and young adult health. And so explaining that it is possible to do this and giving models, I think, will help people realize that it's important work that's going to make a difference. And you have strategies that can guide smart choices in terms of your actions, so that you actually make a real difference. And that's very empowering.
I like what.
Go ahead,
No,
please,
go ahead.
Dr. Call.
No, I would agree exactly with both what Kimberly said and what Carol said. I would also add to that is the same principle that you asked us earlier of how can we collaborate. The same principles. And I think so. One thing which would be important is to share just what Dr. Ford mentioned, the success stories, share the evidence, share the commonality, those common grounds, and then look at it as a journey and not as a destination. Each community, each person, each organization is in a different place, and to accept that they're on a journey, and this whole process is a journey driven and not a destination driven thing. So just kind of to keep that focus would be really helpful. Would motivate people. Talk to them about strength based, about positive youth development. That would kind of really help them to get. And I think so. One key component is patience. Adolescents and those of us who care for adolescents, I can speak for myself, we tend to be a little impatient. I do. I want immediate impact right now. And things that are sustainable will take time, and we need to allow things to evolve on their own. Thanks.
I actually think those are really beautiful, thoughtful words to end on this part of our panel discussion. So thank you so much to all of our panelists, Dr. Ford, Dr. Call, Kimberly, Micah, really thoughtful, helpful commentary. And I want to take just a few more moments now for the part of the discussion that really engages the audience, because throughout the process we have offered sort of a Q&A box. And so now I will share some of those questions to get your insights and thoughts. And I will join into as I see the questions. So one of the questions actually, and I will answer this one, is can you make this an all of government plan and bring these priorities to USAID health and development funding streams too? And so I think that is an excellent question. And I really want to note our intention throughout has been that this would be truly a plan that could be used by anyone. Part of our work has been with more than 25 federal agencies participating in the Interagency Working Group on Youth, and several non-HHS agencies were involved in crafting and refining the plan. It is also not lost on us that we chose to sort of launch or discuss this call to action at a global forum, because increasingly we're recognizing the importance of learning the insights from across the world. As we lead up to the 30-year anniversary of ICPD, we really see that people are sort of reinvigorating their focus on how we support adolescent health and well-being. And I know that the pandemic really laid bare for people that we need to take a whole of adolescent, whole person approach to what we're doing. And so I think this is truly an opportunity for us to continue to say that this is the foundation, but there is so much more. And we really welcome with working with our colleagues across the U.S. government and colleagues across the world with respect to how we implement, because it's really about driving towards the same vision. Okay, the next question I see is, how does OPA plan to engage civil society organizations from Africa in implementing the plan? So I will actually take this one too. I have the distinct pleasure of actually working with HHS's Office of Global Affairs well on a gender equity and human rights portfolio. And I think we are looking to have as many civil society consultations as possible to recognizing the power of the existing multilateral forums. So, for example, coming up even next week in Geneva is sort of the UN Convention on Civil and Political Rights. There will be civil society organizations there. And I think in the ways in which we work very closely with regional partners to get feedback, we will continue to solicit that information because it's so important. And I will also say, we welcome the direct outreach, because I think there's so much to be learned and we really want this to be successful. And then the last question that I see right now, and I'm sorry, these were all questions really for OPA, so I can answer them all, is how does OPA plan to judge whether positive progress is being made? And the good news is that this is actually a great transition point because we will be covering some metrics when we talk about implementation now. So I think this is actually my cue and a really great place to switch to that point and to the final PowerPoint as I close us out. So let me pull that up now. So again, thanks to everyone for those who were really inspiring in that roundtable conversation and the inspiring insights. Here's about what's happening next. In addition to this call to action, we have developed accompanying Take Action Toolkit. And so really this toolkit is meant to be a customizable document that is designed so our allies and partners can use it in concert with the call to action. So like the toolkit pictures tips, it has action planning tools, worksheets, and roadmaps to help partners gather input from young people and the adults that support them. It allows them to set their own goals and identify strategies so that they can align their efforts and take action, because that is the driving force here. So the toolkit will include a section of key resources that were made to develop, and others will assist with plan implementation. And so the resources listed here, as you can see on the screen, are just some of those examples. And OPA will be developing fact sheets and promotional materials, including downloadable social media assets, so that allies and partners can use them and customize them in implementing the plan in different settings. And all of these materials will be posted on our OPA website in late October, and we'll put the URL in the chat. In addition to sharing the action plan and the Take Action Toolkit on our website and via social media, we plan to take this on the road. So in the new year, we plan to travel across the US to meet with young people and adults that care and support for them, to talk about how they can put the plans, goals, and action steps into action and create some new action steps that resonate in their communities. And we're also going to work with select national youth serving organizations to provide specific technical assistance and support around this collaborative implementation process. So over the next year, we'll be working closely with those experts to craft also an adolescent health research agenda, because what we recognize is we really need to strengthen our knowledge base and inform programs and activities. And so this process will involve convening youth and experts in adolescent health again, really to identify research gaps and innovative research methods, and really to expand the research to address the needs of underserved youth and actively involve youth in the co-design, as we talked about, around research evaluations and program evaluations and research projects. And we'll also be working with colleagues inside and outside of government and across from the US in the effort, just as we did in crafting the call to action. So just to the point about metrics, all of that is going to be part of our technical assistance work. And I will say we have accomplished a lot, but there is still so much to do to ensure that our young people flourish and thrive. They are absolutely our future, and we must do our best to make sure they are equipped to embrace it. So in the final minute, I want to thank all of you who logged on today to hear about Take Action for Adolescents. Again, I want to thank our esteemed colleagues and panelists about the important insights they shared, and more importantly, their ongoing commitment to making this call to action a success. I am holding everyone to it. And for those of you who are engaging for the first time around this important endeavor, we really welcome your partnership as allies, as community members, as experts on what we can and should be doing. There are so many people who work so hard day in and day out in supporting adolescent health and well-being. And so it is a true privilege and honor to be working among you all in this endeavor. And with that, I thank you for today's session. and really value this opportunity. Thanks so much and have a wonderful day.